I refer to myself as like an extension of the care team. I'm a nurse. I can triage. I can do all the things that a standard nurse does. But I have the time then that I can actually sit and listen to someone if they're having concerns, questions, if they just need that extra time that maybe an elderly person does or a lower functioning person does, just to really give them that extra attention. Or maybe it's a really complicated diagnosis, and then I can help to kind of guide through that as well and answer any questions, about maybe what the doctor told them, or, just giving more information. So a lot of it is I can really assist and answering most any question, and if I can't answer it, I can go to the provider and they can help me.
How does that help patients with their health literacy and just understanding what's going on?
Exactly. I think the biggest thing to think of when you think of health literacy would be understanding that it is individual to every single person. Every single person learns differently, has a different capability of understanding, basic versus complex things. There's times even as a nurse that doctors will be chatting away and I'll be like, oh, can you say that again? I didn't hear you. I didn't understand you. So, really just asking clarification questions. But yes, if someone has any sort of barrier, whether it's, learning, understanding, or even just feeling comfortable enough to ask those questions, that is definitely a barrier to their health literacy.
Do you have a lot of patients that do come and they are lost with what the doctor has said?
Yeah, I have a lot of patients that misconstrue what the doctors say. One person can think, oh, so and so fired me. Well, no, they didn't fire you. And it's just basically me calling and saying, hey, could you explain to me a little bit what happened with this patient? Or what do you think the next step is? So really where they thought they were fired, it's just saying, you're beyond what I can help with right now. I think you need to go to this person. It's really just that extra set of ears to kind of reassure them.
Okay, what has been your experience with using coordinated care?
Oh, they've been awesome. They've helped me with medications, with health questions.
Well, and Julie, one thing, like you and I mean, we did more than just health stuff too. You had all those questions with your payee, and we reached out to them and we, tried to figure out what your biggest concern with them was. And I mean, there's been a lot of, it's not all medical stuff. A lot of times it can be, just daily life struggles. So
yeah.